Hello, everyone. This is Dr. Stuart Hoover, Doctor of Natural Health and licensed Doctor of Pastoral Medicine. I am the founder of the Essential to Health Advanced Natural Health Care Center in Springfield, Missouri. I've been practicing functional health for over 2 decades, and I want to welcome you to our presentation on functional health, a true healthcare system. Now let's talk a minute about the state of health in America today. And have you ever wondered why we are the most unhealthy and most overweight country in the world? We have the most advanced medical system in the world. Unfortunately, there's little to no focus put on prevention today. Most of the foods that we're consuming are manufactured and processed and providing little to no nutritional value to our body. Billions of dollars are being spent on diets, dietary supplements, and exercise programs every year that are producing little to no sustained results. Folks, there is no one-size-fits-all fix for this. Each and every one of us need to become more educated in how our body functions. We need to learn more about prevention and take a more proactive approach in our health versus being reactive. Let's stop waiting for something to happen before we begin taking action. Now, I want to talk about functional medicine. Functional medicine is a comprehensive and very personalized system. It takes into consideration the entire person, their medical, family, and psychosocial history, as well as their genetics. Functional medicine blends traditional medicine with complementary and adjunct therapies and focuses on lifestyle and nutritional changes to target and prevent illness and disease. Our bodies are complex systems, but often operate on one guiding principle, and that is survival. If our bodies experience excessive stress, this could be emotional, chemical, food, structural, or physical, they simply switch to emergency or survival mode, and logical operating no longer occurs. We must determine the stresses or imbalance on an individual's body, whether it's environmental, hormonal, nutritional, or biochemical, in order to understand the underlying mechanism of the dysfunction. Now let's talk a minute about pathological medicine versus functional medicine. The primary goal of pathological medicine is to fit the series of symptoms and signs of illness a person is experiencing into a category that has already been established. The treatment is then administered, managed according to the diagnosis, not the patient. In fact, the treatment is nearly identical for all patients. In this model, dietary and lifestyle management are rarely emphasized. Competency in this model is based on the standard of care specified by a series of rules followed, not by the individual patient results. For example, the pathological medical model may treat a patient for trouble with breathing by diagnosing asthma as the condition and prescribe an inhaler. The individual's physical activity or lack thereof and the amount of dietary fat a person ingests each day would not be taken into account, and these could certainly be causes to the breathing problem. So let's look at again some of the differences between pathological medicine and functional medicine. On the pathological medicine side, the body is viewed as a machine composed of separate systems. In functional medicine, the body is viewed as a dynamic and complex interconnected system of mind, body, and spirit. In pathological medicine, emphasis is placed on the identification of disease or pathological tissue change. In functional medicine, emphasis is placed on the identification of areas of imbalance or dysfunction in normal physiology. In pathological medicine, diagnosis is extremely specialized. In functional medicine, diagnosis integrates data from many different systems and methods. On the pathological medicine side, treatment is based on reducing and managing symptoms. In functional medicine, treatment addresses the underlying cause of the dysfunction. In pathological medicine, major focus is spent on how the patient is doing based on charts, statistics, and test results that are measured against statistical normal population. In functional medicine, major focus is spent on both the subjective and objective information gathered based on a concept of optimal physiological function. In pathological medicine, they rely on late-stage development of disease as a marker. In functional medicine, it allows for an early detection of dysfunction. In pathological medicine, health is simply measured as an absence of disease. As long as you do not have a disease, you are considered healthy. In functional medicine, health is measured along a wellness continuum, which is a spectrum moving from health to disease. Intervention can be made at every stage of the spectrum to restore and/or improve health and wellness. You know, a good example of this would be when you go to the doctor because you don't feel well, and a series of lab tests are done, and all the tests come back normal. You know, if your lab results are within a normal range, you're considered healthy. But are you really healthy? And I see this every day in my clinic. Clients are bringing in their lab work saying, I've had every test under the sun done, everything's coming back normal, but again, I don't feel well, I don't feel normal. When you think about how lab tests are reviewed, the normal range is based on our general population state of health out there. So you could be anywhere within that normal range. You could be in the middle, you could be towards the low normal or high normal, but as long as you're within this range, you are considered normal. Now, on functional medicine, we actually break down that normal range into 3 functional zones. So where you are in the normal range tells us much, much more. We can determine your functional health range. So a good example of this is I see people in my clinic every day that have diabetes. So when they come in, I'll ask them to bring their last 5 years lab work in. And this is almost exactly what we see every time. 5 years ago, their glucose level was a little above normal. 4 years ago, it was a little bit higher. 3 years ago, a little bit higher. Last year, they were right within the normal range, but at the high end. Now they're outside that range, and they've been diagnosed with diabetes. But for the last 5 years, we've really watched them march towards diabetes instead of intervening back here and really moving the person back more into the center of that normal range, into a more functionally balanced range. Now, I'd like to talk a minute about functional blood chemistry analysis, which gives us a much different picture. This is a functional assessment that we use in our clinic with most of our clients so we can get a better understanding of their true functional state of health. When interpreting blood chemistry lab results, there is a functional range and a pathological range again. Test results that fall between the functional range and pathological range are considered subclinical and can indicate the beginning stages of disease. They should be used as markers indicating something that's not as good as it should be, or they can be a sign of a developing condition that's not bad enough to treat medically, at least not yet. Most medical practitioners today use only the pathological ranges and do not address the subclinical findings until they become a more serious medical condition. The goal is to identify the functional imbalances that may be a developing medical problem and prevent them from manifesting into a serious medical condition. This will help us adjust our lifestyle to support true health and ensure a better quality of life. Over here is a sample to the right of what a functional blood chemistry analysis would look like. And what we do is we enter the minimums and maximums of each of the blood chemistry results and the patient results here. Now we get a much different picture. You can begin to see how far off functionally balanced this person's chemistry is, whether they're low functional or they're high functional. Now, interestingly enough, most of these results on the sample report are within the minimum and maximum. But again, when you begin looking at the functional side, it tells us a much different picture. So a functional blood chemistry analysis can be a very helpful tool in helping us understand your functional state of health. Not only are we getting a good look at where these lab result ranges are, but we're also looking at the top 10 glands and organs in the body and how this chemistry relates to these glands and organs. So we get a better understanding, again, of where the body needs to be supported. Some of the other benefits to doing a functional blood chemistry analysis is it helps us determine which nutritional, homeopathic, and or botanical products will best address the individual needs. You know, a lot of people are taking tons of product out there that may be completely on the opposite side of the fence of what you need to be using to truly help support your body. So this will help you avoid wasting money on the supplement of the month. In other words, on products that provide nutrients that you may not be deficient in or really don't need to be supplementing with. It provides nutritional protocols that address your deficiencies to help your body return to a healthy state. Also provides early detection of emerging health conditions. It's a very inexpensive way to determine how effective your nutritional program is or has been. Follow-up testing allows you to chart the effectiveness of your program and make precise adjustments when needed. It also helps you maintain your blood marker values within an optimal range, which allows your immune system to function better. Allows you to process and utilize your nutrients more efficiently, and helps you live a much healthier, happy, and longer and more vibrant life. And really, folks, that's what it's all about. So if you want to learn more about functional blood chemistry analysis, you can visit us at essentialtohealth.com, or give us a call at our clinic at 417-883-0115. We offer a free consultation to sit down. We can do this by phone or in the clinic to help you learn more about how functional blood chemistry analysis can help you improve your health. Now I want to talk a minute about lifestyle and the impact that our lifestyle has. And the question I'd like to ask you is, are you giving your body a chance to maintain functional wellness? You know, your lifestyle and environment have a direct influence on your health, and these influences are mainly the cause for the development of chronic disease in our country today. You know, some of the causes of functional imbalances in our body are certainly our environment. You know, we're exposed to tons of silent toxins and unseen toxins today. Lots of pollutants, emissions, car exhaust, things that are released into the air that we're breathing every day. Our water sources are polluted or loaded with chemicals today. And folks, these are things that we're just constantly exposed to, and over time we just get a bioaccumulation of these toxins in our body. It's a very slow process, but eventually it could certainly have detrimental effects on our house. Even cleaning products and things that we're using in our house, hygiene products, a lot of these contain chemicals that end up inside our body. Now, most toxins we actually choose today. When you start looking at our foods, most people today are consuming a lot of fast foods, processed and manufactured foods, prepackaged foods. Tobacco consumption is still pretty high in our country. Alcohol use, even pharmaceutical prescriptions can produce a toxic effect in our body, folks. That's why there are side effects to taking prescription drugs. So basically what we're left with is a very sluggish, overweight, unhealthy body. So again, our lifestyle and environment have a direct influence on our health, and these influences affect our health and eventually lead to disease. So you really need to evaluate what's your nutritional program look like. Are you getting moderate exercise? You know, people have become very sedentary today. A lot of this has to do with the foods they're putting in their body are providing little to no energy. So by the time they get home from work, there's nothing left to do but just crawl on the couch with the remote. Our children today, soon as they come home from school, they're grabbing a bag of chips, a soda pop, and they're hitting the TV, or they're sitting in front of the computer, sometimes up to 6-7 hours a day, and not getting any physical activity. Even our pets are suffering today. Pet obesity is skyrocketing just like human obesity today. So it's really leaving us simply unwell. So when you take a look at lifestyle, this really should be the foundation of your health program out there. And really look at what you're doing as far as foods, exercising, getting good, clean, fresh air, hydrating your body properly. And these influences have a great impact on your health and even the expression of our DNA. So, folks, really the bottom line is you have to start with your lifestyle. Evaluate your lifestyle. That's what truly leads to wellness. Now, here's a question I ask many of my clients when they come in the clinic is, how is your energy? Do you have good energy all day, and do you sleep soundly at night? This is a very good indicator of your functional state of health. And this little diagram will basically show how our energy flow is during the day and at night. And folks, about 6 o'clock at night, what happens is our energy level begins to decrease. So about 9 or 10 at night, we should go to sleep very easily. We should sleep soundly 8 to 9 hours at night, get up at about 6 or 7 in the morning, and have plenty of energy. So again, 8 to 9 uninterrupted hours of sleep at night, going to sleep very easily around 9 to 10 o'clock in the evening, waking up at 6 to 7 in the morning with plenty of energy that lasts all day long. And then it starts all over again. And folks, this is really a normal flow, and I can tell you, most people I talk to, that's not how they feel during the day. Most people I find are in a complete reversed rhythm. And what I mean is they're having a very difficult time going to sleep at night. They're going to sleep and maybe up every 2 or 3 hours, just not getting that good restful recuperative sleep, which leaves us very sluggish and tired through the day. And what happens is we literally go into what we call a maladapted rhythm. So this is a very good indicator of your functional state of health. These are things that show up long before any disease will show up in a lab test. So other aspects of wellness and how balanced is your life, you need to look at things like your emotional wellness. This is really our core. Intellectual wellness, making sure that we're continually focusing on learning. This also includes becoming more proactive with our health and learning more about how our body works. Physical wellness, activities that support our physical health. Environmental wellness, how healthy are your surroundings? Again, take a look at your environment, the types of products and things that you're using in your home. Your social wellness, how healthy are your relationships? Occupational wellness, do you enjoy the work that you do? And certainly spiritual wellness. Are you connected really with the big picture out there? This is very important, and these are some of the key pillars to health today. So, folks, the last thing I want to leave you with today is asking the question, do you have a functional wellness plan? And you know, I use PLAN in my clinic as an acronym, and it's very simple. The P in PLAN stands for being proactive. We have to stop being reactive today and really take a more proactive stance when it comes to our health. Again, we have a great medical system that's wonderful at identifying disease and managing that disease, but again, we are the sickest and most unhealthy, overweight country in the world, and it's because we're not taking a proactive approach. Unfortunately, we're waiting for things to happen. You need to begin thinking long term. That's the L in our plan. Stop thinking short term. Most people didn't become unwell overnight, and they're not going to become well overnight. You need to give yourself a little bit of time. Set achievable goals. This is something I see continually in my clinic when I interview people, is that they really have goals that are way beyond their grasp. So you need to really set achievable goals and set things in stages. And the N in our plan, which I think is the most important, is no excuses. There should never be an excuse standing in the way of improving your health out there. That really is truly our greatest asset. At Essential to Health, we offer a 100 Days to Wellness lifestyle plan, and this plan begins with a functional blood chemistry analysis. This program covers several key areas from detoxification to healthy lifestyle practices, all designed to help restore functional health and well-being. And folks, please remember, the best health care plan you can invest in is you. And I encourage you to give us a call at 417-883-0115. You can visit us online at essentialtohealth.com to learn more about our functional blood chemistry analysis and how that can help you gain a better understanding of your functional state of health. And always remember, our initial consultation is free. I'm Dr. Stuart Hoover, and I greatly appreciate you joining me today for this presentation on functional health, a true healthcare system.